let's just address the elephant in the room. There is a massive, massive gap between the Hollywood hype of robot doctors and what's actually happening in our hospitals today. I mean, if you just glance at the headlines, you'd think we're living in some sci-fi movie, right? Where AI is running the whole show, flawlessly predicting illnesses and managing every tiny detail of patient care. But honestly, when we talk to the real people who keep our hospitals safe on a day-to-day basis, well, the story completely changes.
So you might think algorithms are already running our medical systems from top to bottom. But the reality on the front lines? It is completely different. Look, we hear all these incredible stories about algorithms diagnosing diseases from an X-ray literally faster than a human can blink. But what about the operational backbone of our healthcare system? What about the systems that actually prevent outbreaks, track hospital-acquired infections, and make sure the very rooms patients sleep in are safe? That is where the rubber meets the road. And as we're going to see in this explainer, AI is barely making a dent there. Which brings us to the big question. Why are these incredibly powerful tools just sitting on the sidelines when they could literally be saving lives? We're talking about technologies that can rapidly analyze mountains of data, stuff like electronic health records, lab results, surveillance data, to spot an outbreak way before it spreads. The potential here is absolutely enormous. It's a total game changer. Yet the adoption is painfully slow. So what's going on?
Well, before we dive into the AI data, we really need to talk about the human heroes of this story. They're called IPC professionals. That stands for Infection Prevention and Control. These are your epidemiologists, your clinical microbiologists, infectious disease physicians, and specialized nurses. Basically, they're the frontline defenders. They track superbugs, stop healthcare-associated infections, and even monitor things as simple as hand hygiene. They do the grueling, highly complex work of preventing the spread of disease within the very places we go to heal. And to understand AI's real impact right now, we're looking at a brand new landmark 2026 World Health Organization global survey. Now, this isn't some tech company's glossy marketing brochure, no way. This is real-world data from 441 of those frontline defenders right in the trenches. And they span all 6 WHO regions, everywhere from tiny primary care clinics to massive academic hospitals. So we're getting a true, unfiltered look at what they're experiencing across high, middle, and low-income countries alike. Okay, check this out. Nearly 3/4 of these professionals, 74.1% to be exact, say they are already familiar with AI and digital health technologies. So they aren't in the dark here. They know what these tools are, they get the concepts, and they're highly aware of this ongoing digital revolution in medicine. The awareness is absolutely there. But here is the plot twist. They overwhelmingly believe AI is useful. In the survey, they consistently rated AI's potential usefulness a solid 4 out of 5 across almost all applications, things like real-time infection surveillance and monitoring antimicrobial resistance. Yet, a shocking 6.8% actually have the formal training to use these tools safely. Just 6.8%. That is a staggering disconnect. We have this workforce that totally sees the value of the tech, but just hasn't been given the education or the structured capacity building to actually deploy it. And honestly, here is the ultimate reality check. When you ask them if they are currently using AI, a massive 60.3% aren't using it at all. Another 15% are just, considering it. Only about a quarter, 24.5%, have actually implemented AI into their daily routines. So despite all that familiarity and those super high hopes for what AI can do, the vast majority of our global hospital safety networks are still operating completely without it. But for that small slice of the pie, that 24.5% who are actually using these digital tools, what exactly are they doing? Well, they're actually seeing success in some incredibly vital areas. They're using AI for analyzing really complex IPC research. They've got semi-automatic systems actively watching for hospital-acquired infections. They're using AI-supported teaching tools. Think along the lines of digital hand hygiene demonstrations or virtual safety role-play. And crucially, they're using it to detect antimicrobial resistance. That means tracking those terrifying superbugs that evade our current antibiotics. So when it's applied, it really does work. So that begs a massive question, doesn't it? If these tools work so well for surveillance, research, and training, why is adoption still so incredibly fragmented? Why is it that one hospital might have an amazing state-of-the-art AI dashboard, while the hospital just one town over is literally still using paper checklists? Well, the researchers discovered that the issue isn't the technology itself. Nope, the issue is what happens after a successful small-scale test. It's the dreaded pilot-to-scale roadblock. The survey data zeroes right in on the main culprits holding us back. 74.4% of respondents point straight to a lack of training and skills. 71.4% say limited funding is blocking them, and 43.3% cite system integration challenges. Now, this last one, it's huge. Just imagine buying $1 million AI program, but your hospital's electronic health records and lab systems literally cannot talk to it. The reality is frontline workers simply do not have the budget, the education, or the IT infrastructure to make these complex systems play nice together. The researchers hit the nail on the head in the source material, stating many AI initiatives remain proof-of-concept projects that fail to transition into routine workflows. Basically, a pilot project's success means absolutely nothing if it can't survive the messy, fast-paced realities of daily hospital operations. If a tool isn't embedded into the daily grind, if it doesn't have continuous leadership support and a steady stream of funding, well, that early enthusiasm quickly fades and the tech just ends up gathering virtual dust. So, what's the real takeaway here? It's this. We are dealing with an institutional problem, not a technical one. The algorithms, they're smart enough. The artificial intelligence is definitely capable, but actually bringing it into a hospital requires changing the entire culture, updating the governance, and bridging that massive gap between the healthcare workers on the floor and the IT departments down in the basement. So how do we actually fix this and get these life-saving digital tools into the hands of the people who need them most? Luckily, the WHO survey outlines a very clear roadmap. First up, we absolutely must prioritize targeted, multidisciplinary staff training. In fact, 84.1% of the users surveyed said this is the #1 thing needed for adoption. Second, we need shared governance and strong leadership. Hospital management and IT departments need to get on the exact same page with the infection control teams so everyone is pulling in the same direction. And third, IT interoperability. We have to ensure that when a hospital buys new tech, it seamlessly integrates with the old hospital records safely, transparently, and securely. Look, AI is absolutely ready to help defend our hospitals from outbreaks and superbugs. But the real question is, are our hospitals ready for AI? This whole transition is going to require equitable capacity building and a whole lot of human oversight. So I want to pass the question over to you. What do you think the right balance is between human judgment and algorithm automation in a hospital setting? Would you trust an AI to monitor your care environment, or do we always need a human firmly in the loop? Let us know your thoughts in the comments below. Thanks for joining me for this explainer, and keep asking questions.